Hello everyone! Good morning! So, this is my fifth day in the hospital. So, I'm here for laboratory test and some procedures to determine my rising anti-thyroid globulin. So, I have thyroid cancer. It's papillary carcinoma. It's the curable type of cancer a person could have. However, the type of papillary carcinoma that I have is somewhat aggressive. That's why after my total thyroidectomy, the procedure is radioactive iodine treatment where I was isolated in the hospital for 3 days, and then I was prohibited to be near to any person, especially pregnant women and children, for almost a month. So usually, people with thyroid cancer, thyroidectomy and one round of RAI is already enough. However, I have this unusual case of rising anti-TG, which means that anti-TG, by the way, is like a tumor marker. Tumor marker because um, if you come to think of it, I'm living without thyroid. I don't have any thyroid in my body. So I live with maintenance. It's a lifetime maintenance. But still, I have this high anti-TG, which is the result is always normal, abnormal. The normal range usually is until 100, but every time I test for anti-TG, it's usually um, it reached around 3,000 and to 4,000, which alarmed my doctors. So that's why we performed some tests. That's why I'm here to figure out why is it that my anti-TG is increasing. So I'm done with ultrasound. They saw that I have increasing nodules and on my right part of my neck, and but the good thing is that my body scan is cleared. They didn't find anything. So the next step is my doctor scheduled me for an ultrasound guided fine needle aspiration biopsy. So that's what I'm going to do later. So after biopsy, he told me that if we're not going to find anything, we're going to go for a PET CT scan. So I don't know. Maybe I'll just be in the machine and then wait for a few minutes, and when it's finished, we're going to check the results. So PET-CT scan, and then he told me that one option is chemotherapy, but maybe of course we need to make sure if there is really cancer cells after the PET-CT scan. So let's see what's causing this abnormality. So, but I'm hoping na it's not something to be worried about or to be for me to be alarmed. So, let's see, di ba? Living with a thyroid problem, especially thyroid cancer, um, if the dose of uh, it was really intended to increase my TSH. So when you have increased TSH is thyroid stimulating hormone, right? If a person will undergo a whole body scan, the patient is advised to withdraw the hormone tablet to increase the TSH levels. So the side effect is sudden weight gain, and I became so tired all the time, sleepy all the time, depressed. It's true, depressed, and like I don't want to do anything. So that's why for the past days I'm not really that productive. I sometimes I'm in the mood, I have energy, but most of the time I'm not. I don't have energy. So but for my weight gain, I've read that for the sudden weight gain, it's also difficult to lose the weight that I have gained. So let's see. I'll after I get out of here, I'll go back to the gym, which I always say. But let's see. So that's all. Thyroid cancer is not something na, well, cancer is scary. That's why if you have a chance to undergo a medical exam, or um, if you don't have any benefits in your company, take initiative to test your body for any illnesses, because I promise you, early detection is really the best. Early detection. If in my case, if I discover this like after 10 years, it for sure it will be worse. Worse. I struggled in the therapy, in the surgery, but just imagine if I discover this like after 10 years or after 20 years, it might be impossible, or it might be already hard for me to cure my illness. So go for early detection, test yourself, check your neck for any lumps, check your neck like this. When you check your neck, by the way, you put your both hands. I can't do it because I'm holding the phone. So put your hands here and then swallow your saliva and test if there's any lump. Yeah. And then also for the women, your breast, because there might be any cyst, which could be either benign or malignant. So test yourself, and of course, make it a point to have a happy and stress-free life. Go for a healthy living. Go for proper diet and exercise, which I have to do also for myself. So that's all. Um, Life is still good. So thank you. Mind your health. Bye bye.